Hello, everyone, and welcome back to the Easy English Talk. I'm Anne.
And I'm Max. Hi, friends. It's so great to have you with us again.
Absolutely, Max. Doesn't it feel amazing to practice English together?
Oh, totally, Anne, totally. And today, wow, we've got a super useful topic, something you're very likely to use in real life.
Real-life English, not the stuff from textbooks.
Exactly. Today we're talking about how to communicate at the doctor's office, how to describe your symptoms, ask questions, and stay calm without panicking.
Yes, you know that moment when you think, my stomach hurts. Maybe I'm sick?
Exactly, Anne. We want you to feel confident, calm, and clear even when you're not feeling your best. So let's go over some practical phrases and natural ways to talk to a doctor.
And before we dive in, if you enjoy learning with us, please give this video a like. Seriously, it takes one tiny click, but it helps so much.
Yes, it helps more learners find us and support our channel. And if you haven't subscribed yet, hit that subscribe button so you don't miss our upcoming lessons.
All right, Max, ready to get started?
Let's do it.
Okay, picture this with me. You wake up in the morning and everything hurts. Your head, your back, your throat, everything feels awful.
Oh man, Anne, that sounds like one of those mornings where you just want to stay under the covers forever.
Exactly. And in my head, I'm thinking, I need help. I need a doctor. Tea won't fix this.
Right. And here's an important tip. People often forget this. The first step is to call the clinic before you go.
Yes, don't just show up and say, help, I'm dying.
Exactly. But if it's an emergency, of course, head straight to the hospital. Otherwise, call first, make an appointment, and ask when they're available, today, tomorrow, or next week.
All right, Max, let's practice. You be the receptionist, and I'll be a very sick human.
Okay, receptionist voice on. Good morning, Sunshine Health Clinic. This is Mark speaking. How can I help you today?
Hi, good morning. My name is Anna Rivers, A-N-N-A, Rivers. I'd like to schedule an appointment with a doctor, please.
Of course, Mrs. Rivers. Before we continue, can I have your phone number in case we get disconnected?
Sure, it's 555-987-3210.
Thank you. And what seems to be the issue? What symptoms are you experiencing?
Well, I've had a really bad headache since last night. I also feel feverish, my throat is sore, and I have a little cough.
I'm sorry to hear that, Anna. We definitely want to help you feel better. We have an appointment available at 3 p.m. this afternoon. Would that work for you?
Yes, 3 p.m. is perfect. I just want to see a doctor as soon as possible.
Understood. When you come in, please bring your insurance card, a photo ID, and a list of any medications you're taking.
Got it. Insurance card, ID, medications. I'll write that down so I don't forget.
And one more thing. If your symptoms get worse, like trouble breathing or a very high fever, go to the emergency room immediately.
Okay, thank you, Mark. I appreciate the advice. See you at 3.
Take care, Mrs. Rivers. We'll see you soon. Get some rest until then.
I'll try. Fast forward, it's 3 p.m. and I drag myself to the clinic. I sit in the waiting room, trying not to cough on anyone.
Oh, yes, those waiting rooms are always quiet and tense. Everyone's secretly judging each other's coughs.
Exactly. Then a nurse calls my name. Anna Rivers?
I stand up and say, "Yep, that's me."
The nurse smiles. Hi, Anna. Please follow me. We'll do a quick check before the doctor comes in.
I follow down the hallway like a little lost puppy.
The nurse usually measures your weight, height, and sometimes temperature.
Why do they check all that? My height won't fix my sore throat.
It's just basic health information. It helps the doctor understand your overall condition. They may also check blood pressure.
Blood pressure? That sounds serious, like a superpower.
Kind of. Blood pressure measures how strongly your blood is moving through your body. Quick, painless, just a little squeeze on your arm.
Ah, okay. So just a quick check to make sure my body isn't freaking out.
Exactly. After that, the nurse usually takes you to a small exam room and says, the doctor will be with you shortly.
Then I sit alone, staring at weird posters on the wall, trying not to Google my symptoms.
Never Google symptoms. You'll convince yourself you're dying.
I'm in that room nervous but also relieved because help is coming.
Finally, the doctor walks in smiling.
I'm ready. Nervous, but ready.
Knock, knock. Hi, I'm Dr. Max Taylor. Nice to meet you, Anna. Please have a seat.
Thank you, doctor.
I looked at your info. Weight, temperature, blood pressure, they all look normal so far. That's good.
Very good. Now, tell me what brings you in today.
Wait, what does "what brings you in today" mean?
It's a polite way of asking why you are here or what problem you are having.
Ah, got it. Well, I feel really sick. Headache, sore throat, fever, everything hurts.
Let's talk about your symptoms.
Symptoms?
Yes, symptoms are the things your body feels when it's unwell.
Okay, first, a strong headache, maybe a 7 out of 10.
Noted. Any other symptoms?
My throat hurts a lot. Talking, swallowing, it's painful.
That's a sore throat. Very common. Coughing?
Just a little dry cough.
Dry cough. No mucus, just air. Got it. Fever.
Yes, last night I felt very hot, then cold.
Checked your temperature?
28.5 degrees Celsius this morning.
Definitely a fever. Low energy?
So tired, just want to sleep all day.
Typical when your body fights something. Appetite?
Not hungry, only drank some juice.
Even if not hungry, small meals help recovery. Soup, porridge, gentle foods.
I'll try soup. And water, right?
Hydration is very important.
Got it, doctor. I mean, Max. You can call me Max. Doctors are people too.
Now, a quick physical exam. Nothing scary.
I trust you, but still scared.
Normal, Anna. Open your mouth, say ah.
Ah,
Throat very red, irritated.
feels like fire.
Now ears. Head still, please.
Is this the thermometer?
No, an otoscope. Light to see inside. Doesn't hurt, just weird.
Okay.
Ears look normal, no infection.
Phew.
Now lungs. Deep breath in and out.
In, out.
Perfect. Lungs clear? Excellent.
Wow, good news.
Timeline. How long sick?
2 days, worse yesterday.
Medication?
Nothing yet, wanted doctor first.
Smart choice. Based on symptoms, I think it's the flu. Viral, not bacterial.
Flu? Dangerous?
For most healthy adults, no, but tiring, miserable. Body needs time to fight.
What should I do?
Rest, fluids, prescription for headache and fever. Make symptoms easier. Body fights virus.
Twice a day medicine plus throat lozenges.
Yes. Any allergies?
No.
Great. Here's your prescription. Take it to the pharmacy. Any questions?
When can I go back to work?
2 to 3 days, until fever gone, 24 hours without medicine.
Rest, fluids, medicine, lozenges. Got it.
You should feel better in a few days. Worsening symptoms, call immediately.
Thank you so much, Dr. Max.
You're welcome, Anna. Feel better soon.
Wow, that was a complete doctor visit. Headache, fever, throat, cough, everything.
Not every sickness is the flu. Allergies, reactions, many reasons people visit a doctor.
Next, let's talk about allergies, common in everyday life.
Yes, food, animals, dust, pollen, many triggers.
Shall we do a role play? You're the doctor, I'm the patient.
Ready.
Hello, Dr. Max.
Hi, Anna. What brings you in today?
My nose won't stop running, eyes itchy, sneeze every 5 minutes. Started this morning.
Did you eat or touch anything new? Pets, plants?
Visited a friend with a big fluffy cat. Played a lot yesterday. Fine yesterday. Awful today.
Could be an allergic reaction, especially if not used to cats. Am I allergic now?
Not necessarily. Reactions can happen sometimes. Breathing okay?
Yes, just discomfort. Nose blocked, throat itchy, sneezing.
Typical allergy. Annoying, but not dangerous.
Do I need medicine?
Yes, over-the-counter antihistamines. Avoid cats a few days.
Got it.
Now let's look at another allergy scenario. Hello, doctor. Please have a seat.
Thank you. Tell me, what seems to be the problem today?
Well, I have something unusual with my skin.
Your skin? Can you describe it?
It's really itchy, and I have red patches on my arms and a little on my neck. It feels very uncomfortable.
Itchy red patches. Sounds like an allergic reaction. When did it start?
This morning, I looked in the mirror and saw it everywhere.
Interesting. Did you eat anything different yesterday or change any products you use on your skin? Soap, lotion, detergent?
My meals were normal, but I tried a new shampoo last night. Smells like strong flowers.
That could be a clue. Sometimes new products have ingredients that your body reacts to. You might be allergic to something in that shampoo.
Oh no, now I'm scared to wash my hair.
Don't worry. First step is easy. Stop using the new shampoo immediately. Go back to your usual one. Your skin will likely calm down on its own.
No more new shampoo. Got it. But the itching is driving me crazy. What can I do?
You can get hydrocortisone cream at the pharmacy. It reduces itching, swelling, and redness. You don't need a prescription. Just ask the pharmacist.
Hydrocortisone cream. All right, I'll look for it. How often should I apply it?
Usually 2 to 3 times a day on the affected area. Use a thin layer. Don't over-apply.
Thin layer, not too much. And if it doesn't go away?
If the spots don't improve in 2 days or worsen, come back to see me. But usually stopping the shampoo is enough.
Whew, that makes me feel better. Thank you, doctor.
No problem. And maybe next time, don't switch to a mystery shampoo at night.
Lesson learned. Stick to the familiar shampoo.
Exactly. All right, Anna, today we covered a lot. The flu, allergies, skin reactions, lots of real-life situations.
The key is always to describe your symptoms clearly so the doctor understands your situation.
Yes, tell them what's happening, when it started, and if you tried anything new, food, medicine, or products. It helps the doctor help you faster.
We also introduced some useful phrases. What seems to be the problem? How long have you had these symptoms? I have a headache, or I have a sore throat.
And don't forget practical tips. Rest, fluids, taking medicine, using lozenges.
Exactly. Now, before we finish today's lesson, let's do a mini vocabulary review.
Great idea. Let's practice some words and phrases we used in the doctor's office scenarios.
Okay, first word, symptom.
Symptom. Yes, a symptom is a sign that something is wrong with your body. Headache, fever, cough, these are all symptoms.
Example sentence. When I visited the doctor, I described all my symptoms: sore throat, fatigue, and headache.
Perfect. Next word, prescription.
A prescription is a note from the doctor that lets you get medicine from a pharmacy. Some medicines you can't buy without it.
Exactly. Example, the doctor wrote a prescription for my fever medicine.
Next, pharmacy.
Yes, a pharmacy is where you get medicines. People sometimes say drugstore. You can also buy small items like toothpaste or soap there.
Example, I went to the pharmacy to buy cough lozenges.
And our last word, appointment.
An appointment is a scheduled meeting with a doctor. You don't just show up, you make a time in advance.
Example, I made an appointment for 3 p.m. with Dr. Taylor.
All right, let's try a short story using all 4 words.
Yesterday, I wasn't feeling well. I had several symptoms: headache, fever, and a sore throat. I called the clinic and made an appointment. The doctor saw me, gave me a prescription, and then I went to the pharmacy to get my medicine.
Perfect. That uses all 4 words naturally.
Remember, learners, making your own sentences with these words is the best way to remember them.
Yes, don't worry if it's hard at first. Keep practicing, and it gets easier.
Now let's move on to some tips for describing symptoms clearly to a doctor.
Tip 1. Be specific. Don't just say, I feel sick. Say exactly what hurts, how bad it is, and when it started.
Tip 2. Describe changes. For example, yesterday I felt fine. Today I have a fever of 38.5 degrees Celsius.
Tip 3. Mention any new exposures, like new foods, plants, animals, or products you used.
Tip 4. Talk about your daily energy and appetite. Doctors want to know if you're able to eat, sleep, or do regular activities.
And tip 5. Ask questions if you don't understand something. Don't be shy.
Exactly. For example, what medicine should I take? Or can I go back to work tomorrow?
Another important part is timing. How long have you had the symptom? When did it start?
And also severity. How bad is it? On a scale of 1 to 10.
These details help the doctor figure out what's going on and how to treat you.
Now let's practice a small dialogue with phrases and vocabulary we've covered.
Okay, you be the doctor, I'll be the patient.
Hi, Anna. What brings you in today?
Hello, Dr. Max. I have a headache and my throat is sore. I feel very tired.
How long have you had these symptoms?
Since yesterday afternoon.
Any new foods, products, or exposure to animals?
No new food, but I played with my friend's cat yesterday.
I see. Any cough or fever?
A little dry cough and a temperature of 38 degrees.
All right. Based on your symptoms, it sounds like a mild viral infection. I'll give you a prescription for fever and pain relief. Rest and fluids are very important.
Thank you, doctor. Should I avoid the cat?
Yes, for a few days. See if your symptoms improve.
Got it.
Great. That was a full conversation using symptoms, prescription, pharmacy, and appointment naturally.
Exactly. And learners, notice how we used questions, specific details, and natural expressions.
Yes, you can practice these conversations at home with a friend or even by yourself.
Remember, repetition helps. You'll feel more confident talking to a doctor in English over time.
All right, before we wrap up part 2, let's quickly recap key points from today.
1. Describe your symptoms clearly. What hurts, how bad, when it started. 2. Mention any new exposures, food, animals, or products.
3. Take note of energy levels, appetite, and daily activity.
4. Use key vocabulary, symptom, prescription, pharmacy, appointment.
And 5. Ask questions if you don't understand something.
And don't forget, rest, hydrate, and follow your doctor's instructions.
We also learned how to handle allergies, like itchy skin, red patches, and reactions to animals or products.
Yes, and we practiced natural English phrases you can use at the clinic. Next, we're continuing our practical English lesson about visiting a doctor, describing symptoms, and getting advice.
Exactly, Anne. We talked about allergies and skin reactions. Now we'll focus more on common colds, flu, and talking about your recovery. And we'll also cover mini lessons on pronunciation, example sentences, and natural phrases.
Perfect. Let's start with a common situation. Imagine you wake up with a mild headache, a runny nose, and a little cough.
Oh yes, that's when you think, maybe it's just a cold?
Exactly. And the first step is still to call your clinic or check with your doctor if symptoms are getting worse.
Right. It's always safer to get advice early, even for minor symptoms.
All right, let's do a role play. You're the patient this time. I'm the doctor.
Okay. Hello, doctor.
Hi, Max. What brings you in today?
I have a mild headache, runny nose, and a little cough. Feeling tired, too.
How long have you had these symptoms?
Since last night.
Any new foods, products, or exposure to pets?
No new food, but my neighbor's dog ran up to me yesterday.
Okay. How about your temperature? Did you check it?
Yes, 37.8 degrees Celsius this morning.
Slight fever, okay. Any trouble breathing or chest pain?
No, just the mild symptoms I mentioned.
All right. It sounds like a common cold, mild viral infection. No prescription needed, but I recommend rest, hydration, and over-the-counter remedies if needed.
Got it, doctor. So rest and fluids are most important?
Yes. Also, if your symptoms worsen, higher fever, breathing difficulties, or persistent cough, come back or call immediately.
Makes sense. Can I go to work tomorrow?
If you feel well enough and fever is gone, yes. But ideally, rest one more day to recover fully.
Okay, I'll do that. Thank you.
See? Simple, natural conversation using phrases like, what brings you in today? How long have you had these symptoms? And describing your body's condition.
Exactly. Now let's talk about practical phrases for describing symptoms in more detail.
Good idea. First, use pain scale. From a 1 to 10, how bad is it?
Right. Example, my headache is a 6 out of 10. Gives the doctor clear information.
Second, describe type of pain: sharp, dull, throbbing, burning.
Example, my throat feels scratchy and burning.
Third, describe frequency: constant or intermittent.
Example, I cough occasionally, or I sneeze every few minutes.
Fourth, describe timing: when it started and if it gets better or worse at certain times.
Example, symptoms started yesterday evening, worse at night.
These small details help the doctor give better advice.
Now let's practice using all these details in a realistic dialogue.
Okay, I'll be the patient, you're the doctor.
Hi, Anna. What brings you in today?
Hello, Dr. Max. I have a headache, sore throat, and a runny nose. I feel tired and slightly feverish.
How long have these symptoms been happening?
Since yesterday evening. Headache is about 7 out of 10, and my throat feels scratchy and burning.
Do you have any cough or sneezing?
Yes, occasional dry cough and frequent sneezing.
Any new foods, drinks, or exposure to pets?
No new foods, but my friend's cat brushed against me yesterday.
All right. Fever this morning?
37.9 degrees Celsius, slightly elevated.
I see. Your symptoms suggest a mild viral infection, common cold, or early flu.
Should I take medicine?
Rest and hydration are most important. Over-the-counter remedies for fever, headache, or sore throat are optional.
How many days until I feel better?
Usually 3 to 5 days for mild symptoms. If worse or persistent, come back.
Got it. Thank you, Dr. Max.
You're welcome. Notice how we included symptom details, timing, severity, and possible causes. Very realistic.
Exactly. Let's move on to another important topic, talking about recovery and progress.
Yes, after a few days, you might need to report changes to your doctor.
For example, my fever has gone down, but I still have a sore throat.
Or, I feel more energetic, but I'm still coughing occasionally.
These phrases help the doctor adjust advice, medicines, or tests if necessary.
Right. Let's do a follow-up dialogue. You're the patient.
Hi, Dr. Max. I'm feeling better today. Fever is gone, but still some throat pain and occasional cough.
That's good news. Any other symptoms?
No, just fatigue when I climb stairs.
Okay. Keep resting, continue hydration, and use lozenges. You can go back to work if comfortable.
Great. Thanks for your guidance.
You're welcome. See? Easy, natural conversation. You're telling exactly what's happening in your body.
Exactly. Now let's do a mini lesson on vocabulary for recovery phrases.
Good idea. First phrase is, I'm feeling better. Simple, clear way to show improvement.
Next is, fever has gone down, important for viral or bacterial infections.
Third is, I still have a sore throat. Explains remaining symptoms.
Fourth is, occasional cough, indicates frequency.
Fifth is, feeling fatigued. Describes low energy.
Let's practice with a short story using these phrases.
Last week, I had a mild flu. At first, I felt very sick. Headache, fever, sore throat. After 2 days, I'm feeling better. Fever has gone down, but I still have a sore throat and occasional cough. Feeling fatigued, I stayed home to recover.
Perfect. That includes all the recovery phrases naturally.
Yes, and learners notice how small details make a big difference when talking to a doctor.
Exactly. Describing your symptoms and recovery clearly is key to getting the right advice.
Now, before we finish part 3, let's do a quick role play combining everything we've learned so far.
You're the doctor, I'm the patient.
Hi, Anna. What brings you in today?
Hello, Dr. Max. I had a fever and sore throat, but I'm feeling better today. Fever is gone, still some throat pain, occasional cough.
Any new exposures or medications?
No new exposure, just taking over-the-counter pain relief.
Good. Keep resting, drink fluids, use lozenges. You can go back to work if comfortable.
Thank you, doctor.
You're welcome. That's how you summarize your symptoms, recovery, and current status clearly.
Exactly. Practicing these dialogues helps you feel confident speaking with real doctors in English.
And remember, learners, practice makes perfect. Don't be afraid to role play at home, with friends, or even by yourself.
All right, let's start with a new role play. This time, you're the patient, I'm the doctor.
Okay. Hello, Dr. Anna.
Hi, Max. What brings you in today?
I've been feeling very tired and my stomach hurts. I also feel dizzy sometimes.
How long have you had these symptoms?
About 3 days.
Have you tried any medicine or remedies so far?
No, I wanted to consult a doctor first.
Good idea. Any changes in your diet or exposure to new foods or drinks?
Yes, I tried a new energy drink 2 days ago.
That might be related. Let's talk about your pain. On the scale from 1 to 10, how bad is your stomach pain?
Around 6. Constant dull ache.
Do you have any nausea or vomiting?
Just a little nausea in the morning.
Okay, I'd like to run a few tests to be safe. In the meantime, let's focus on rest, hydration, and light meals.
Got it, doctor. Can you explain what the tests are for?
Sure, they help check if there's any infection or digestive issue, basic blood work, and maybe an ultrasound if needed.
Understood. And how should I describe how I feel during the test or treatment?
Use clear phrases like, I feel a little pain here, or I feel dizzy when I stand up.
Ah, so it's important to express feelings clearly.
Exactly. Doctors rely on your descriptions to provide the right care.
Great. Now let's do a mini lesson on advanced vocabulary we used today.
Good idea. First, dizzy, feeling lightheaded or unsteady.
Example, I feel dizzy when I stand up too quickly.
Next, nausea, feeling like you might vomit.
Example, I have nausea in the morning.
Third, ultrasound, a test using sound waves to look inside your body.
Example, the doctor recommended an ultrasound of my stomach.
Fourth, digestive issue, problems with your stomach or intestines.
Example, I may have a mild digestive issue causing stomach pain.
Fifth, hydration, drinking enough fluids, very important when you're sick.
Example, drink water frequently to stay hydrated.
Now, let's combine symptoms, feelings, and treatment plans in a short dialogue.
I'll be the patient.
Hi, Max. What brings you in today?
I've had stomach pain for 3 days, feel dizzy and slightly nauseous.
Have you tried any remedies?
No, I wanted to consult a doctor first.
Good. I recommend rest, light meals, and hydration. We may run blood tests and an ultrasound to check for digestive issues.
Okay, doctor, I'll follow your instructions.
If you feel worse, stronger pain, vomiting, or high fever, come back immediately.
Got it, doctor. Thank you.
See how natural that conversation feels? You're combining symptoms, timing, severity, and treatment advice.
Exactly. And learners, notice how we added feelings: tired, dizzy, nauseous.
Yes, expressing feelings clearly is just as important as describing symptoms.
Now, let's talk about how to ask questions about treatment.
For example, how often should I take this medicine? Or how long until I feel better?
Or, are there any side effects I should watch for?
These are natural, polite ways to get more information from your doctor.
And don't forget phrases for understanding instructions, like, so I should drink water every 2 hours? Or, I take this medicine after meals, right?
Exactly. Repeat instructions back to make sure you understand.
Great. Let's do another role play, practicing treatment instructions.
You're the patient. I'm the doctor.
Hello, Dr. Anna. I have stomach pain and nausea.
Take this medicine twice a day after breakfast and dinner. Drink plenty of water and eat light meals. Rest as much as possible.
So I take the medicine twice daily, after meals, and drink water frequently.
Yes, that's correct.
Got it. Thank you, doctor.
Perfect. That's how you confirm instructions and show you understand.
Now, let's do a mini vocabulary review for treatment phrases.
First, take medicine after meals. Clear instruction for timing.
Second, side effects, possible reactions to medicine.
Third, follow instructions. Do exactly what the doctor says.
Fourth, recovery time, how long it takes to feel better.
Fifth, consult a doctor. Seek advice when unsure or symptoms worsen.
Example story using these words. I had a mild stomach issue. The doctor told me to take medicine after meals, watch for side effects, and follow instructions carefully. Recovery time is about 3 days. If unsure, always consult a doctor.
Great! That wraps up our vocabulary for advanced treatment discussions.
Before we finish today's full lesson, let's do a quick recap of all 4 parts.
Part 1, calling the clinic, describing initial symptoms, visiting the doctor, and first exam.
Part 2, allergies, skin reactions, using clear phrases and vocabulary like symptom, prescription, pharmacy, appointment.
Part 3, common colds, flu, follow-up, describing recovery, and using details about severity, timing, and frequency.
Part 4, advanced phrases, expressing feelings, treatment instructions, side effects, recovery time, and confirming understanding.
We also practiced natural conversations, role plays, and mini vocabulary lessons.
Exactly. All these skills together help you feel confident speaking English at a doctor's office.
And don't forget, learners, practice is key. Role play, repeat dialogues, make sentences with new words, and describe your own experiences.
Yes, every practice helps you communicate clearly, reduce anxiety, and get the care you need.
Before we go, here's a question for you.
1. What do you usually do when you have a cold? Drink tea, rest, or take medicine?
2. What's a common medicine for headache in your country?
3. Do you visit a doctor easily or only when you're very sick?
Write your answers in the comments. We read every single one and love seeing your practice.
Yes, don't be shy. This is a safe space. No one is perfect. We're all learning together.
Remember, just by listening and practicing with us, you're improving your English every day.
If you enjoyed this lesson, please like the video and subscribe to
Easy English Talk.
Share it with friends who are learning English. It helps our community grow.
We read all comments, and it makes us super happy to see your progress.
All right, everyone. That's it for today. I'm Max.
I'm Anne.
This is
Easy English Talk.
helping you speak English with confidence and maybe laugh a little too.
See you next time.
Bye, everyone.
Bye.